We have some great responses. Now let's start with the second question. So what may be the best starting point to address this topic in asthma? I believe Renee, and forgive me, I'm pronouncing your first name incorrectly, has already started us with this question. So the best place to start is in Austin, grant funding for new HVAC systems in schools. Goals for 2025 is to get it on people's minds as important. So what's another best starting point to address this topic of indoor air quality asthma? Great, we have no bus idling, prevention education of asthma triggers. Great starting points. So the next question, what solutions may be first considered? No, you're not cheating. So education around what factors can trigger asthma. That's also a great point. So if you can make a list, 1, 2, 3, of what solutions may be first considered. I would invite you to type that in the chat. Top first, second, and third of the solutions that may be first considered when it comes to this topic. Okay, we have Rachel who said simple solutions that families can do themselves: dust, vacuum, pest control, smoking cessation, no pets in beds. Perfect. Great example of some education we can do. And we have Heather with education of asthma triggers as 1. 2, linkages to resources such as home weatherization, integrated pest management, new funding sources. We have educate public issue about serious issues in Texas as 1, training programs, 3 legislation changes. Perfect. All great solutions that should be considered. So now let's go to short term. What are the goals for 2025 regarding this topic? So again, we're talking about indoor air quality. So what are the goals for 2025 regarding indoor air quality? You can do both. You can do state and your personal goals. So things you would suggest for the state, and then things that you personally would want or are hoping to address within your organization, or maybe a personal goal you have to address within your organization. Thank you for everyone who has shared so far. I see a lot of consensus online around education, so we'll move into that topic next for these questions. But does anyone else have any closing thoughts for indoor air quality and addressing it? Okay, so let's move on to addressing education with these questions. So, with the topic of education in mind, what are the most important priorities to address with this topic? Thank you, Heather, for that question. I think we can start with self-management education, but I think all of those are important components to consider when it comes to education. But we can start with self-management education and then branch off to educating providers on best practices and education in general. So, what are the most important priorities when it comes to addressing self-management education to start? So again, what is the most important priority to address self-management education? What may be the best starting points to address this self-management education? And what solutions may be first considered? So let's move on to the second question. So what may be the best starting point to address self-management education? We have great responses. So identifying their current understanding of the plan and asthma in general, action plan, identifying their current resources, supplies, medications available. Again, using the asthma action plan as the best starting point for self-management education. It's perfect. So implementation of general education at the beginning of each semester of the school year during regular events like Meet the Teacher. Incorporating ASME into providers' practices if they don't have the time. Referral to nurse or CHW. Make sure the patient knows how to use their medicine spacer before they leave, can show how they use it. As our speakers mentioned, some of them who are medical professionals, that they only have 15 minutes. So to be able to give the patient further education is very essential. Okay, and again, let's type 1, 2, 3. What solutions might be first considered when we consider self management education? So, what solutions may be first considered regarding self management education? Okay, we have some great solutions to consider. So, we have um, looking into the possibility of free of cost programs to families, maybe finding a way to incorporate billing, and use those funds right back to use for asthma education, asthma management, spacers, masks. Start with family medicine practices, encouraging them to use the latest recommendations. That's great. That goes into educating providers, taking advantage of resources already available like Asthma 411. More free programs to provide free albuterol to school districts. Yes, yes, that's a major, major topic of discussion that we will probably go into in our debrief as well. Yeah, and I love the idea of teaching other kids about asthma so they can be advocates for their friends. I think that's great. As our keynote speaker mentioned, sometimes you need that one person that will stand up to the bully being asthma, to be able to advocate for their. Okay, and what are the goals that it could be your personal goals, your organization goals? What goals do you have when it comes to educating on self management for 2025? Goals you could see for the state, goals you could see for your organization, goals you personally have when it comes to educating our community members, our providers, organizations on how to address this topic of self management education. You have some great responses to the question on what are the goals when it comes to self-management, self-asthma management. So we have, um, the goal of having organizations continue to study asthma and air quality issues, include an educational component to their program, continuing to educate the kids and their families, making sure they have an action plan, informing providers, nurses, families about available asthma programs, and then more asthma support groups. Yeah, I think that's a great idea of having an asthma support group, maybe even having parents involved, parents of kids with asthma support groups within their communities. So again, offering a space for them to come and go that also has the ability to provide asthma education. Yeah, I think that's a great idea, a great goal for 2025. I know we've incorporated a lot of education aspects in our responses. So a lot of you have mentioned the education of some providers, education of general public, in terms of what goals to address and priorities to address when it comes to education. Do we have any other thoughts when it comes to education for providers or the general public? Or I know we have a lot of you in this call that provide education to the general public. So what are some solutions do you think should be first considered when it comes to education or educating the general public about asthma? So again, what solutions might be first considered when educating the general public about asthma? Again, you can list them in one, two, three. You have some great responses when it comes to the question what solutions might be first considered when it comes to educating the general public about asthma. We have required training when they pick up medication from pharmacy, prevention triggers, educating their MDs, getting general public to care about sharing stats, very important, empowering the population to take action by giving them options to get involved. Great. What other solutions might be considered when it comes to educating the public, general public about asthma? And I love the component of getting medical professionals involved. But also, we've seen throughout the presentations the importance of community health workers also being that liaison between the hospital and the communities that these community health workers are coming from. Okay, I will transition us over to our next chosen topic, which was access to healthcare. So, what are most important priorities to address when it comes to access to healthcare? I know some of you have answered this question within the education aspect, but what are the most important priorities to address when it comes to access to healthcare in regards to asthma? We have some great responses. So cost is always a big priority to address when it comes to healthcare access. Transportation to visits, yes. Enough area providers. Availability of medications. So I think this goes into the next question of what's the best starting point to address the topic of healthcare access. So what's the best starting point do you all feel for addressing access to healthcare when it comes to the topic of asthma? We have streamlining the process, making it easy for families to enroll in Medicaid or insurance. What would be another great starting point to address this topic? Implementation. Great. Great starting point. Once you've already collected the data, fund the research the need for access. Okay. And then someone said they really likes the CHW's approach to having someone in the community that can help families navigate the resources available. Yeah, sometimes the CHWs are the first access that some of these families have to getting the access to healthcare that they need, having an advocate to speak up for them. So, what are some goals that we have regarding access to healthcare in your organizations, or some of the goals that you personally have that you want to address, or some access to healthcare needs that you see that you're currently addressing within your organizations?
Can you go back one slide so I can see what the group's for? Okay, do you want to do online first then? Okay. Hi, all. We're going to start our debrief. And Leslie Reyna did the online folks, which was a good group. And she's going to kind of discuss what they talked about.
Hi, yes. So we did two topics for the online group that we discussed. So we discussed, actually, we did three. So we did indoor air quality, education, and access to healthcare. So when it comes to indoor air quality, they discussed the importance of legislation. When it comes to indoor air quality, smoke-free policies across Texas, also legislation to support tenants, regarding mold, um, apartment or rental home maintenance. They also said that the best place to start is in Austin, grant funding or new HVAC systems in schools. And goals for 2025 is to set in people's minds as important. And then we have solutions when it comes to this topic. So simple solutions that families can do themselves, such as dusting, vacuuming, pest control, smoke cessation, no pets in beds. They also said some of the top three things to address when it comes to this topic is education of asthma triggers, linkages to resources such as home weatherization, integrated pest management, new funding sources. And then they also talked about educating the public about serious issues in Texas, training programs, and legislation changes. So topic of education was big in our online group, as we have a lot of people who are focused on providing education to the community, to providers, and general public. So they one of the solutions was implementing indoor air quality program in our district. And then they did break down, again, education by self-management education, educating providers on best practices, and educating the general public about asthma. So they talked about educating the public on how to utilize medication spacers to prevent episodes, making it accessible and digestible for those who regularly deal with asthma, parents, families, schools, and understanding the asthma treatment plan, advocating for yourself and your child. We also had some of our online members talk about the importance of maybe even having a buddy in a school system to be able to speak up for that child that has asthma. So as our wonderful keynote mentioned, the person that fights the bully, hear the bully being asthma and speaking up for them. And then again, emphasizing the importance of having an action plan, identifying current resources. And then when it comes to education as well, the importance of billing and costs to families when it comes to getting asthma management items such as spacers, masks, and those sort of things. And then we talked about the priorities when it comes to education. So more programs to provide free albuterol to school districts, taking advantage of resources already available like Asthma 411. And again, the importance of the being beneficial to teach other kids that don't have asthma about asthma so that they are aware. And then lastly, we talked about access to healthcare. So again, the importance of informing providers, requiring training when they pick up medication from the pharmacy, giving education regarding prevention of triggers, educating your MDs, getting the general public, again, like some of you have already done, to share stats about asthma and its impacts, and are empowering the population to take action by giving them options to get involved. And then again, addressing the cost, which is a big concern. I think we're all trying to figure out how to work. And then cost of medications, finding a PCP, finding medical coverage, knowing medical coverage options, streamlining the process, making it easy for families to enroll in Medicaid and insurance. And then someone said they already researched the needs for access. Now it's time to implement and address those needs. And then again, they emphasize the importance of having community health workers to be that liaison between these medical organizations and the community. Yeah. So that's a quick summary of the three topics we address.
That was you addressed a lot in a short period of time, and it sounds like there's some health policy themes. There's a big education theme in the community, and sounds like there's some school themes as well that were really really important. And so um, I think that there's a lot of action that we can make out of that. And I did the indoor air quality, or we all did the indoor air quality, but I guess I'm the speaker for that. And so we had Kelly, we had Samara, we had Joey, Marquita, and Leslie and myself. And we talked a lot about a lot of different things in indoor air quality, but kind of the biggest things we talked about were indoor air quality as it relates to schools, and how that can be a big challenge, and perhaps reaching out to schools for to educate them on indoor air quality, and the need to really improve indoor air quality in schools, which I think they'll listen to since COVID. Um, we also um, we also talked a lot about kind of the bigger challenges with indoor air quality for those folks that are renters. That's a really big challenge, and you know, there's things that Marquita has done. With her program, and one of the big challenges is that they're renting, and then they say they can't use like the carpet cleaning or the pest mitigation because their landlords won't let them do those things, even though these are big challenges. And so we thought of a short-term goal is to reach out specifically to those apartment complex associations to see if we can make a business case that doing some of these things are really important for their business actually. And so can we find some data that shows that if you decrease the number of asthma exacerbations, parents go to school and they're paying rent, kind of more on time, and kind of things like that. And then we and then actually, but we need data behind that. So find data that actually shows that doing some of these things are beneficial. We also talked about what we need to do with these short-term kind of actions need to be. And also Joey talked about a shared model of possible funding as well. Finding funding from multiple different places to make this better, because because apartment complexes don't want to take all of the costs, and we don't want to push all the costs to the renters as well. And we talked about specifically those folks that are undocumented are a really, really vulnerable population, particularly in this area, because they don't want to use legal means actually to enforce some of these things to make their asthma better. But perhaps we can firm up some medical legal partnerships in order to make things better. And then lastly, we talked about we got to meet, and I don't love meetings, but we hopefully kind of as a group, we can meet on a monthly basis, but kind of on this specific indoor air quality issue, we can meet on a quarterly basis. What else? Anything else that I missed from our group? Nope. Okay. And then we'll move on to outdoor air quality. And where's Susan? Is she still here?
I'm hiding.
Oh,
I thought if I would hide, then you couldn't see me.
I don't know if you designated another spokesperson, but I designated you the spokesperson.
So I was stuck with the pad, so that meant I was the scribe and the de facto spokesperson. So we actually had a pretty lively conversation, and we covered a lot of ground. We had a lot of folks with experience in schools. And so while we were talking outdoor air quality, a lot of it kind of touched on experiences in and around schools. So one of the things was the recent UIL call to look at heat index through a wet bulb test. And a lot of schools don't have that equipment, and so they're kind of going with AQI. Heat index and AQI do kind of go hand in hand. And there was concern about that's for the athletes, but you also have to consider that for recess as well. So there was a lot of talk about, well, how do you look at outdoor air quality and the impact on schools? And can you provide education around asthma impacted students so they're not stuck sitting in the nurse's office if it's a bad air day, not doing anything, and all their friends are out playing? And so I thought that was a really good consideration. Apparently, at one time, there was a system of air quality flags at schools so that coming in, people would know. And so that was an idea to maybe bring that back. The other consideration that we talked about was idling for both buses and parents. That's a site-specific air quality challenge that most people don't recognize. We identified a policy priority of maybe reaching out to the state because they are the ones that issue air quality permits for pollutant sources. Right now, they issue those permits on a one-by-one basis. And so you can have areas like West Dallas where you have 20 batch plants within like a 4 or 5 square mile area because they've all been independently permitted and no one is looking at cumulative impacts, which is a significant challenge if you have a population of students or adults with asthma. So that was a policy thing to look at. We also talked about having opportunities for local subject matter experts to work with schools and the community to kind of explain what's going on with air quality issues. And that can be a language challenge between technical speak and normal speak, and normal speak in multiple language. And so that's a consideration as well. There was several conversations around expanding the community advocacy programs, because we feel like that's a really good liaison between the schools and the families and the health providers. Let's see, what else do we have here? Right now is when a lot of the legislation that will show up in January is being written. So there may be some immediate potential opportunities to speak with some of our legislators around implementing some legal changes to make air quality better in some of our neighborhoods. One of the intermediate needs that we identified was advocating for more measurement, and not just more sensors, but some nice central place where somebody makes sense of the data that's coming in and it's publicly available for people to use, I think would be helpful. And then short-term goals were to talk to school boards or others for funding related to asthma-related health interventions, looking at local cities around idling reinforcement, using trip planning software for ISDs for when they're using their buses. And then landscape equipment and education came up. And then the other option was to look at safety gear for impacted communities. And that's what we had. It was a very robust discussion.
That was a wonderful summary. I'm just going off, but it sounds like one of the big things that we really need is, in addition to these different areas, is probably a school health area, because it sounds like there's indoor and outdoor air quality school health issues that can be addressed in an impactful and meaningful way. But the next group is education. Okay.
Hello, that was our group. It was comprised of myself, LaShonda, Clarbella, Rosemary, Christina, and Shamara. And we talked about the important priorities to address this topic being asthma action plans and educating the community on the importance of those, and educating families on the importance of sharing that information with their schools and really having that partnership. Also education on controlled versus maintenance medication, having parents be more knowledgeable about those things. So some of the community health workers, so that when they're talking to the parents, sometimes they don't understand the difference, and so they label them by colors or something. And so really just providing more education related to that. And then we also talked about education in schools, just not just with the school nurses, but really just with all the staff, related to just even just basic asthma information to help with those kiddos that have asthma in the schools. And then we said the best way, or the best starting point, would be to identify who needs the most education. And we know we talked to the parents, but we also said that it would be a really good idea to include siblings, any caregiver that's with those families, but also the child itself. We thought about, kiddos that maybe have diabetes or something. They are pretty well educated in knowing how to do the things that they need to do for diabetes, but also just making sure we're educating the child who has asthma about, those different things. And so making sure that we include that. And then solutions, we talked about, again, including the siblings in those conversations. I think some of the community health workers with the Healthy Homes team, they talked about how when they're going over those binders, making sure that the siblings and kiddos are sitting at the table too and going over those with the parents. And then maybe having incentives for those families to keep them engaged when giving that information to them. I think Shamara suggested, like, even if you're just giving them like a water bottle or a $5 gift card or something like that to just keep them engaged, that they also may be more receptive to the information you're giving them. And then goals for 2025, we said bringing key stakeholders in the community to collaborate on what's happening in the counties. Ideally, I think you mentioned monthly, but we thought, even quarterly also, just to get started, would be a good thing. And then increasing CHWs around the healthcare systems would be a good goal.
So I just have one comment, and I really appreciate Sade mentioning the school health component of this. And I think the important part is, I mean, both the needs that are within schools, but also the need for that partnership and communication across the sectors, and ways that can be strengthened and the communication can be strengthened. And I just wanted to mention that we do have a representative here. I'm sorry she was down the table from me, so I couldn't see her initially. But Sarah Hieroman is a school nurse at one of our partner districts. And Sarah, she's worked with the Asthma 411 program, and she's actually part of our professional development module on that. So Sarah, I'd just like you to introduce yourself, maybe say just a word or two on that before we move on.
Oh, you just have to touch it. That's so.
But not the microphone.
Hi, everybody. I'm Sarah Harriman. I'm a coordinator for health services for Arlington ISD. And we have been fortunate to use the unassigned albuterol program since I came to Arlington over 16 years ago. But then we got on board with Asthma 411, and we're fortunate that we are able to source our albuterol through Cook Children's. And the difference this program makes for our kids, and for any of you ISDs online who are considering this program, it's revolutionary, I think, for the school nursing, for the way we can treat kids and care for them. Our return to class rate for kids who utilize the Asthma 411 program last year was 69%. So that's a lot of kids who would have gone home. And these students also get education, monitoring from their campus nurses, and resources. We're able to connect them with more resources because we have access to the 411 program in Cook Children's. What would be super helpful for us is to have asthma action plans for each student so that we can follow their care. And so, because if we have an asthma action plan for a student, we can communicate with the physician and give feedback about how the student actually is doing, what their needs are, what that looks like. I'm super stopped in my tracks when she said control medications can't keep up with the precipitates and the problems in the homes. And so I would like to hear more about the Healthy Homes program and how we can connect our students with that program to, nip these problems as much in the bud. But our goal is to have students healthy and in school, and Asthma 411 has dramatically improved our ability to actually do that for students. So super grateful for all the work everybody's doing here, the data collectors, the environmental people, the housing people. We work together and we take care of our kids. So thank you, everybody.
Thanks, Sarah, to you and to all of the school nurses who are out there on the front lines trying to support the health of our children every day. Thank you.
So that was really, really helpful and provided a really great perspective. So we really appreciate that. The next group was access to healthcare, and I don't know who's, okay, there you go.
Yes, so we had a really great conversation. Didn't always stick to access to healthcare, but really just trying to process all the information that we heard shared today and what it meant, and adding our own experience from our different perspectives to it. But to speak to access, we were looking at some big drivers might be access to insurance and access to medication. How do we bring the healthcare to our families? And then really talking through what are some of those barriers or some of these structural pieces, these regulatory pieces that are in place for good reason, for patient safety and quality and all of that, but that are like inhibiting our families having easy access to get their medications, or as was discussed earlier, where the physician's the only one who can write an asthma action plan. But so where are places we can push back against some of those areas to broaden the number of folks or the type of folks who can intervene with a family in these different ways, because the families, as we said, are with their physicians for that 15-minute little increment, and then everywhere else all the other times. And so there's a lot of potential for others to help that way. Another thing we talked about was language barriers and this sense of health literacy, but knowing that some families, not some, most families have a deep respect for what their physician tells them. So if their physician tells them, they're more likely to listen to that and um, um, take that to heart. But somewhere along the way, that integration of, okay, here's what they told me and here's what it means for my specific situation and what I need to do gets a little jumbled. So when a community health worker or someone else, some other kind of helper comes in to help interpret that and put that into action, there's a disconnect, and families say, oh no, that's not what the doctor said. The doctor said something else. And so just knowing that other helpers, other providers, whether it's an asthma educator or a community health worker, or any of the case managers who come in, have to be really thoughtful about, like, where is this family coming from? What did they hear from their physician? What did they take away? And what did they internalize that to mean? And be able to navigate that conversation. So that's a really important skill that we would want to build and invest in. And then I think we talked about a lot of different things, but I think one other thing that kept coming up for us over and over was it's really any solution is going to require multiple levels of interventions from multiple sectors across the community. We know this, we've been talking about this, but I think so many of us are used to just working in our one little area because that's what we know, that's what the policies allow for, that's what all the structures are built for. But again, how can we break down some of those barriers to broaden that and bring in those different organizations, different types of interventions that are all working in the same direction. And from our CHW's perspective, that wraparound care for a family. It's not just the clinical asthma, but what are these other things impacting?
That was amazing. Some themes that I've heard, and if anybody else wants to like speak up, please do, because it sounds like I said school health already, but it sounds like community health workers is a really big theme, and maybe we can talk a little bit more about how they can be used. It sounds like getting out of our silos is a theme as well. Like we need to have more communication between kind of these different sectors and different folks, which is part of the goal of this summit. And it seems like overcoming barriers, and there's multiple barriers in order to really take care of families with asthma. And that seems to be a big theme. And then within those themes, there's things like asthma action plans and getting those asthma action plans together. There's themes of within access to healthcare, to really kind of reach out to those folks, and same with education, and with indoor and outdoor air policy. It seems like there's a big theme of policy as well. And so there's a lot of different places where we can act, but it seems like one common thing for action items that we can do is we can meet on a regular basis to really discuss these things and give people some actionable kind of things to do in order to move this forward in the future. So I'm going to hand this back over to Leslie again, unless anybody else has any input they want to add or anything else.
When we did the word cloud of asking people like what topics that they wanted to discuss, one of the ones that came up that we did not discuss today was cultural barriers. So that is just want to keep that in mind for everyone here. That's something that people were also interested in addressing or feel like it was an important topic to address when it came to asthma is the cultural barriers. And I don't know if anyone wants to, you don't have to, but to come off mic and talk about that.
I will. Yeah, so there are a lot of cultural barriers that we don't know about, which is why I think community health workers are really important as well. One of the things that I talk about kind of when I sit down in a room, when I say, I think your child has asthma, do you think your child has asthma? And if they tell me no, I'm like, so tell me what are some of the reasons why? What are some of the challenges? Or when they tell me yes, I also say, so what are some of your concerns or what are some of your fears or what are some things that you want to do in order to help make your child's asthma better? That takes a lot of time, but I do think that it does overcome some of those barriers. But one of the biggest barriers is language acquisition. And so we have translators that sometimes they can't be in the room. And I can tell you that the way that you communicate with a translator is with somebody who speaks the same language or somebody who's able to be there to help with that makes an enormous difference. And in person versus on the phone or virtual makes an enormous difference in your ability to really connect with your patients. And so, I really feel like having those community health workers that are able to speak multiple languages is important as well. I think Spanish is the most common one, but I think there are a lot of immigrant populations that do not speak our language and that do not speak English. I said our language, I'm so sorry. And we need to find those community health workers within those communities to reach out to them because it's not just we're saying that it's majority Black and Hispanic folks, right, who have asthma, and that's the truth. But there are other populations that need help, and especially those populations who live in those apartments that don't look great because they might not be documented. Anyway, go
Can I
ahead.
piggyback on her?
Yeah, please.
You're fine. So
I was saying,
we have in the program that I lead, Spanish speaking nurses, respiratory therapists, and admin people, and it makes a world of difference from especially from a cultural standpoint and speak their language and understand that goes back to the non-judging when you can relate. We also pride ourselves on printing stuff in people's first language, and I don't care what language it is, English, Spanish, whatever you come into the hospital with, and that's your first language, you're going home with an asthma action plan in that language. And we have created asthma action plans in so many different languages and down to health literacy and pictures. And so it is important from a cultural standpoint that we do address those because people just feel comfortable talking to people they feel like know them and come from where they come from.
Yeah.
Yes, it's not just talking about the language when it comes to culture. You also have to take into consideration the routine, the do's and don'ts. For instance, in certain culture, you don't speak to the wife, or the husband has to make the decision, or you have to get permission from the husband. And if you're going into the homes, you also have to take into consideration the shoes, taking the shoes on and off, and because those are the signs of respect and understanding, and some culture, they it's customary for them when you come to the home for them to offer you something, a beverage or something or that sort. So you just, you can decline or you can take it and take it with you or something like that. But it's just all those little details, all these little things. It's not just the language, it's just everything else that comes along with that. And for us being in the home, I could tell you, I got all sorts of stuff, given to us, food and cookies and, things like that. And so it's just, they make them feel good by offering you something because you come into the home. And so all of those things that also are important into connecting with that family and to making them feel like you understand and the non-judgment, like, so then they could open up to you and talk to you in a way that you can really get in there and help them out.
Such a valuable perspective because they come to my house, right? They come to my spot where I am, and I don't go out to where they are. So that's extremely valuable. Thank you.
I think I want to thank you as well. I think that's so important how we can kind of shut down a relationship without intending to if we don't understand what that individual's expectations and what their needs are when we walk in the door. And I also want to just mention to the point of the extent of the diversity of our languages is something that constantly surprises me. And I know, Sarah sees this in schools, but there's school districts that talk about being over 50 languages on one school campus. So, that's difficult. And yet, when we've also put some of our written information in, gotten them translated into Karen and Daria and things that languages I didn't know existed. It's really made a difference to those communities, and I know we'll be transitioning into kind of a wrap up, but I just wonder if, perhaps having some folks really speaking specifically to the community health worker, the options for reimbursement and whatnot might be something we want to do going forward. And I just wonder, boy, can we get some more champions from some of these other sectors? It's going to be tough to get somebody in housing, but maybe we could find one or two people who are in that housing sector and who care about this issue, and would be willing to connect with us. And I think that might be a really great thing to be able to do as well.
They have kids.
They ought
might
to.
have a kid with asthma.
And I want to thank the folks who just, have been working with programs and just spoke up now. I would hate for us to close out today. I'd really love to hear from anyone that we haven't heard from yet. As I said, I think each person's perspective here is really important. So thank you so much.
Okay, so we will go on to our final remarks with the wonderful Kelly, who will be giving us our closing thoughts.
Well, thank you everyone for your attendance today. Those who are online, those who are still in the room with us, and our previous guest speakers. Thank you to our sponsors, all of the attendees, everyone for your comments and feedback. We've had some great discussions as a group and in some of the breakout sessions as well. There will be a QR code on the screen in a moment, so please remember to complete that post survey. Your feedback will be absolutely helpful. The initial planning committee will reconvene and meet and kind of structure all the feedback that we were given today and share that with you. We'll follow up with you all in a couple of weeks, and we'll coordinate. Sade mentioned it a little earlier, but the frequency in which this North Texas Asthma Coalition will meet. And so the frequency of that, and then when some of the subgroups would meet so that we can continue to do this work. So this is just starting, but we would like to collaborate and work on some of these short and long-term goals that we discussed today and have some working meetings, if you will, so we can continue the work for this region. So thank you all again.
And then
go ahead.
So we got to do planning and stuff like that too. So that's going to be a part of this. So if you're interested in is that in the QR code? If they're interested in
Yeah, it's in the QR code. So when you complete that post survey, there will be questions asking you if you want to be part of that conversation we're going to have after this. So the planning committee for these different topics.
Absolutely. Absolutely. And it may be you or it may be somebody else that's at your organization that you feel would need to be a part of that group. Or maybe someone was not here today. I know we did invite other charter schools were mentioned, school districts were mentioned, and we know it's summertime, they had a lot of priorities too and might not have been able to make it. So we still want to engage some of those other sectors that we talked about as well today.
Yeah. And the people who have already left or are left early for online, you will be getting this post survey via email after this. And I'm also planning to have the presentation slides, the community resources slides, and the full recording of this entire summit on our Asthma 411 website. So I will send out that link too once everything is on there.
Thank you. You all have a great afternoon.